Okay. Thank you, folks, for bearing with us for a couple of moments here. We were speaking to Legislative Council on one of these measures. We will call this meeting to order. We're going to hear a bill and a resolution today. We're going to begin with Senate Bill 215. My understanding is Senator Walker is in another meeting, cannot be here, and Representative LaHood, who is carrying this bill for him, should it move to the House floor, will present the bill. And I know, Representative LaHood, you spent a great deal of time explaining the measure at the last meeting. There was a lot of good discussion on this bill. And so, Representative LaHood, I want to make sure we have the correct LC number. There has been some changes made, and I want to make sure that everybody knows the correct LC. Tara, make sure I have the right one. Okay. All right, the LC number for all of our members, most of whom are remote, it seems, LC 338807S. Okay, that is 338807S. This substitute to Senate Bill 215 was emailed to all of our members at 10 a.m. this morning with changes that were placed in this bill after last week's hearing. As everyone here is aware, I'm kind of a stickler about hearing bills before we vote on them so that we can give thoughtful consideration to them and make any necessary changes in advance of the next meeting. That was done. I usually strive for 24 hours in advance before you get a substitute. That is not a requirement, but I kind of try to do that myself. In this case, you had it at 10 a.m. this morning. And so, Representative LaHood, you will explain LC 338807S, substitute to Senate Bill 215.
Thank you, Mr. Chairman. So I appreciate the opportunity to present this on behalf of Senator Larry Walker. I was able to work with him and the Department of Community Health. Also met with the governor's office, his health care policy staff, and I believe we've got a bill that everybody is good with, all the stakeholders, also the Nursing Home Providers Association, and as well as the Senior Living Association. So the changes that have been made since the original bill was presented are basically towards the end, starting on line 66. And what's been added here is the ability, or it says the department shall approve employer-based programs sponsored by or offered in assisted living communities, private home care providers, personal care homes, or other long-term care facilities licensed by the department for certified nurse aid training and competency examination programs in the same manner as such programs are approved in nursing homes as determined by the department. The department shall require all employer-based programs to meet the requirements set forth in 42 CFR 483.152 and other applicable laws and regulations. So that's the section that was added. And like I said, all the stakeholders that have been involved in the discussion are good with this, and I want to thank the department for working with me to approve employer-based training programs. This is going to be really good for long-term care workforce. It's going to open up a pipeline of workers that are very much needed, and it's going to be good for senior adults in Georgia, and I think good for all involved. I think it's important to mention that no training here is being diluted. It's still going to have to meet CMS requirements, and the nursing home providers, in the original intent of their bill was to be able to employ certified medication aides, and that stays intact. in this bill. So, be glad to answer any questions if there are any, Mr. Chairman.
Okay, we will hit your button if you have questions. For Representative LaHood, I want to just ask one question myself, just to be clear, Representative. This new section really, unlike the balance of the bill, which relates directly to certified medication aids, speaks more fully to CNA training and in the settings that those employer-based programs can be in. So it's separate in that it speaks to the CNA program, which of course an individual must pass before they become a certified medication aid. Is that correct, Representative?
That is correct.
Well, thank you, sir. All right, questions from the committee. Representative McDonald.
I just want to make the motion at the proper time to do pass.
Okay. All right, not the appropriate time. Let's get questions first out of the way. Any other questions from the committee? Okay. Representative Fry. Representative Fry, you must be muted. We can't hear you. I'm going to turn it on and off again just to make sure. You should be on.
All right, can you hear me now?
Yes, sir. We can hear you, Representative Fry.
Okay, thank you, Mr. Chair. And Chairman LaHood, I just have a question about this last section. I know there are about 600 schools, small businesses here in the state that already train for these positions. And I was just wondering, how do you see the effect that it would have on these existing entities that do this work? Thank you.
All right, thank you for the question, Representative Fry. The way I see this working is what this language does is open up the opportunity for long-term care settings, the settings listed here, long-term care settings such as assisted living communities, private home care providers, and personal care homes to be host clinical sites. See, the CNA program contains, I think it's 80 hours of classroom work and then 24 hours of clinical training. And I could be a little off on the hours. The 24 may be included in the 80. But the way I see this working is these technical colleges and high schools that are teaching the CNA course will continue to do so, and these long-term care settings will partner with those schools to be host sites for the clinical portion of the training requirements, where without this bill, the only eligible sites to host clinicals are hospitals and nursing homes. This will open up the more opportunities to accomplish the clinical training. And these other long-term care provider types are required to employ CNAs in certain circumstances, so it only makes sense that we would allow them to train there too. And like I said, create a workforce pipeline for the entire spectrum of long-term care providers.
Thank you, Representative. And Representative Fry, thank you for the good question. I would add something that some of our newer members may not be aware of. We had, a few years ago, we had a study committee on the workforce shortage in this state. As everyone should be aware, we have a tremendous workforce shortage with caregivers in this state. One of the recommendations that came out of that study committee was to have more community-based settings available for CNA training, which is precisely what this provision would allow for. So the training would still be the same training offered in the same settings, but the clinical piece, which now has to be in skilled nursing facilities, the clinical training would now be available in more community-based settings for long-term care as well. Thank you for the good question. I think we have another question. Oh, I'm sorry. Representative Fry for a follow-up.
Thank you, Mr. Chair and Chairman LaHood, for that explanation. That clarifies it. I just really wanted to make sure that we weren't increasing new competition opportunities against our existing small business sector that trains the CNAs in the state, because they seem to be doing a good job. And just to be clear, you're saying that all this does is opens up a clinical setting. It does not authorize the entities to be able to train their own workers.
So this would authorize an employer-based program. So if the employer, meaning the long-term care provider, chose to hire their own instructor and do this program all on their own, they could. I don't see that happening often at all, if ever, as long as the technical colleges and high schools that are already teaching this are willing to do enough classes to produce the pipeline that's needed. The only reason an employer would want to take on this expense on their own and bypass the existing school is if those schools are not producing enough, if they're not having enough classes to produce enough of the workforce. So as long as they're doing that, the employer is going to be more than happy to just partner with them and be a host clinical site.
Okay. Any other
Mr. Chair, may I
questions
have
from the
one
committee?
more? I have another question, please, sir.
Oh, yeah, go ahead, Representative.
And now, so let me get this straight. So we would be authorizing employers to incorporate a CNA training program into their existing business to train their own workers for certification.
That's correct. And the skilled nursing providers can do this now. And I think it does happen in some cases. But most providers, instead of taking on this expense on their own, are going to want to partner with the existing school. And that's what makes the most sense. The only reason that the provider would want to bring an instructor in-house and bypass the existing schools if that school was unwilling or unable for some reason to produce enough students, enough graduates of the program, and that's it. I believe the schools are going to love this because we're offering more opportunities for them to increase the flow of students and giving them more opportunity to partner with employers in the community.
Okay, well, certainly as a policy position, I've got to think about this a little bit more, but I appreciate your explanation and your time. Thank you, sir.
Okay. Remotely, Representative Mitchell has a question. Representative, we haven't been able to hear you. We can't hear you.
Can you hear me now?
I can hear you now. Start from the beginning, please.
Great. Thank you. I had a question, given your last statement that said the skilled nursing facilities do have the ability to train their own staff. Now, what percentage of training is actually happening in those facilities? Because it does not necessarily follow that if one type of facility does do in-house training commonly, the other one would not.
Okay, Representative, let me see. Is there someone here from the nursing home industry that can help us answer this question? Did y'all hear Representative Mitchell's question? Could you help us, Russell? Yes, I'll get you wireless mic. Okay, you should be. Try now.
There we go. On switch. Yes, ma'am. My name is Russell Carlson. I work with represent the Georgia Healthcare Association, which does represent 95% of the skilled nursing facilities. So, ma'am, I'm here at the podium. If you can restate your question.
Sure. Looking at the bill, the argument for saying it wouldn't take away from the current schools now is saying that these facilities would not necessarily be likely to train their own staff. The question is, given the facilities that currently do have the possibility to train their own staff, what percentage of facilities are actually doing that?
The percentage of facilities now training their own staff, it's not a very robust number, but the ones that have the volume and the capacity to do so find it to be very efficient.
So you do expect then that with this change, we would see the same thing happening in other facilities?
Yes, ma'am. We would love to take full advantage of these opportunities as in the aforementioned workforce concerns that we do have, especially in the COVID environment. Yes, ma'am.
Okay, Representative, I think Representative LaHood wants to respond as well. I want to make sure that I understand, Mr. Carlson, and thank you so much. There's a relatively, so you're speaking, of course, to the educational piece, the 80 hours piece, outside of the clinical side that I alluded to earlier. Okay, Representative LaHood wants to speak to Representative Mitchell's question.
Representative Mitchell, I want to offer a further explanation, and I appreciate the good question. So the reason this bill is necessary, there's a couple reasons, but one is that assisted living community are required to employ CNAs because that's the prerequisite of becoming a certified medication aide. And without the ability to host the clinical portion of their training, we're assisted living communities and other long-term care type providers are missing out on the opportunity to expose those students to those environments where as a place they might want to work. The nursing home providers are now asking in this bill to employ certified medication aides, which I think is a good idea. But it's going to strain the workforce, and so that's what makes it necessary, and all the stakeholders agree. It makes it necessary, and it will help the workforce pipeline to open up to more training sites. And the other reason this bill is necessary is because there's currently a shortage of certified nursing assistants. Any provider will tell you that we just can't find enough of them. And the turnover in this industry is high. One of the reasons is it's a stopover job for a lot of people, where it's a more entry-level job, and it's a stepping stone on the way to becoming a nurse or some other advancement in healthcare. And so because it's a stopover job for so many people, we need a continuous pipeline. And this will help to ensure that we have a continuous pipeline. And if the existing schools, technical colleges and high schools, were producing enough of them now, we wouldn't need this. And so what I'm hoping to do is work with the local schools, to increase their volume of students in the CNA program, and just simply becoming a clinical site. I'm a provider of assisted living services, and it wouldn't make sense for me to go hire my own in-house instructor when I could partner with the local school. And if the school's willing to do that, then there's no threat whatsoever to their student base. It'll actually increase it, I believe.
Okay, thank you, Representative. The chair has a question for Mr. Carlson back there. I want to make sure I understand something. Having studied this bill, but wasn't here, as y'all are aware, last week, the nursing home industry does support this language. Is that correct?
Yes, sir.
Want to make
Yes,
sure
sir.
that I'm clear on that.
Representative LaHood has been very,
And so what we're
forthcoming.
doing is allowing, to kind of 30,000-foot view this, we're allowing CNA training, which is, every provider, every hospital, every nursing home, every long-term care provider in the state is, nobody can hire enough of them. We need them produced. We need more than we can find. We're now allowing not only skilled nursing facilities to train them on the clinical side, but also to have an employer-based program, but now expanding that to other community-based settings. Is that correct?
Yes, sir.
And y'all
I
are
think-
supportive of that measure?
I think the advocacy for workforce
Yes.
is something that we don't have many turf battles over.
Yeah, it's a common, it's a common battle. We're all
Yes, sir.
fighting to hire people.
Yes, sir. We encourage people to get an interest in long-term care, whatever their best entry point might be.
Yeah, thank you, sir. Okay, I want to, I think before we move on, I want to go back to Representative Fry, because I think he has another follow-up question. Let's go to Representative Fry first.
Thank you, Mr. Chair. I really feel like there's a little bit more to cut loose on this addition, and I think we're talking about two different issues. I appreciate the fact that we want to expand opportunities for our CNA schools to train their workers. I absolutely get that. That would help the pipeline. Two questions, sir. Has there been any effort to contact the schools and ask them, are they really overcrowded and turning away students? Is the pipeline problem an issue, or is it a pay issue where there's a high turnover rate because they don't make a lot of money?
Representative Fry, that question is directed to Representative LaHood. Is that
Either one of
correct?
y'all are in the industry. I'm just trying to get my head around this.
Okay, Representative
sir.
LaHood, that question's for you then.
I think there was more than one question in your statement there. One was, have there been efforts made to work with the technical schools? And the answer for me personally is yes, exhaustive efforts. And it's been my experience that a lot of the technical schools don't have an appetite to teach the CNA program, period. CNA program and stop there. They teach the CNA program as a part of an LPN course or a part of a nursing school. It's like the beginning parts of a greater program to a higher degree or diploma. About a year ago, Chairman Sharon Cooper, chairman of Health and Human Services, worked with the governor to open up the Hope Scholarship, to cover CNA courses. And about that time, the pandemic set in, and the state just hasn't had a good chance to work that program and to get it going. So I'm anticipating that between the Hope Scholarship covering CNA courses, that will encourage tech schools to offer more of CNA courses for students who want to become a CNA. And again, the problem with making the CNA course a part of a bigger program, like LPN, for example, is the student typically goes through the CNA course and goes right into the nursing portion of the program and doesn't even bother to go take the CNA state exam because that's not of interest to them.
All right, thank you, Representative LaHood. We've got several other questions. I want to make sure we get these, every member addressed. Representative Gamble.
Thank you, Mr. Chairman. Just as a follow-up from our last meeting, I think the problem here, and I love our technical schools, but the problem is that they're chasing other degree programs or promoting other degree programs for our students. And this is going to help us solve kind of a catch that we're in where we're missing some students because of that. and also allow some of these providers who can give on the job training. You know, that's a big challenge we've got, because a lot of folks don't want to hire anybody without experience, but you've got an opportunity to train them and give them experience on the job with what we're poised to do, if I'm correct. And I know that's not a question, it's more of a statement, but Representative LaHood, that's kind of where we're at with this. It's not an attack at the technical schools, it's just giving more opportunities for students, and it's also tied in with on-the-job training, and it seems to me to be a win-win.
That's the way if I
You're on.
may.
You're on.
Representative Gamble, thank you. And that's exactly the way I see this. It's a win all across the board. It's a win for the schools. It's a win for the employer. It's a win for the employee. It gets everybody what they need. And, I appreciate the concern brought forth. And without having a deep understanding of the issue, I could see where that might be a concern, but this is simply a solution to a workforce problem.
Okay, Representative Robichaux, who is remote.
Thank you, Chairman. And I guess my question somewhat comes to that. My understanding is that a lot of it, there is the coursework, but then there's also what I would call the practicum, or what we used to call the practicum, the, on the face-to-face training. My understanding is, I would love to know how many, while we say there are 600 schools that teach this, how many slots are there available to do these practicums as you think about it? Because that could also, unfortunately, be one of the limiting factors, because I know in hospitals and in other healthcare settings, you can only bring in so many people to be trained at a time, with your instructors and those kinds of things, even with direct patient care. So I somewhat agree with Representative LaHood that there should be a partnership. And this, to me, also would seem to be opening up those practicum slots availability, because they would still have to be trained the correct way. Am I reading it correctly?
Representative LaHood.
I think you're reading it very accurately, and I think it's a good thing to expose people who may be intimidated to enter a nursing program, LPN or RM program, but they might have the confidence to go to a 12-week program to become a certified nurse's assistant, get exposed to the healthcare field. It's not the highest paying job out there, but it gets some exposure, gets some experience, and it might just be what they need to take the next step to get into another program and advance their career.
Okay. I believe we have exhausted all of our questions. I would just add one thing. I think I do agree with Representative Robichaux's comment. When I think about the opportunity for people to get their training and at the same time be paid for doing so in a work setting, that would be, I would think, a benefit. And of course, as has been pointed out, I think over and over again, there's such a dearth of caregivers. We've got to find any and every way we can to get more caregivers. It's a good news. It's good news when people advance and they become a CNA and they immediately migrate to another position and they grow and they become an LPN and then an RN, and as we see so often, that is a good thing. But we've got to continue to have that supply of people who will take care of our particularly the most vulnerable in this state. All right, I see no further questions. If there are none, it is now an appropriate time for a motion, as was offered earlier by Representative McDonald, or whoever would choose to do so. Okay, we have a motion from Representative McDonald to pass. We have a second. Yes, I was going to turn it over here to pass the committee substitute to SB 215. And again, because I want to make sure everybody's clear on this, that is LC 338807S is a committee substitute that we now have a motion and a second on. Okay. Any further discussion from the committee? Any discussion? All right, no discussion. All in favor? say aye or hold up your hand on, if you're remote, so that Ms. Tara can know how you're voting. Okay, any opposed? Hold up your hand or say nay.
Nay.
Okay,
Nay for me. I couldn't seem to get the right one. Nay.
okay,
Nay for me also.
Nay for me, Scott.
okay. You got those.
Bazemore.
We're just, give us a moment here to make sure we've got it correct.
It's nay for me as well.
Okay, Representative Bruce, nay. You got that, Tara? Okay, we have, so the vote is 12 to 5.
Bazemore.
This substitute, you got Ms. Bazemore?
Mitchell
Okay.
as well.
And Representative McLeod, no.
Yep, we've got you, Ms. Representative McLeod. Okay, the measure passes 12 to 5. Substitute to Senate Bill 215 is passed. Thank you, Representative LaHood. Now, there she is. Representative Lott will present House Resolution 236. I think you are on back there. Representative Lott, see if that works.
I think so.
Yeah.
Thank you, Mr. Chairman and members of the committee, for allowing me this opportunity to come here with a study committee resolution. It is LC 338677. This is a safe staffing resolution for the nursing profession. And long before COVID, we were having these conversations about staffing and nursing, burnout, shortages in the state, shortages in our universities, and trying to get those nurses into our all of our areas where nurses are necessary. But of course, our hospitals have giant shortages as well. So this conversation started many, many years ago. And as a matter of fact, as a nurse myself, it was one of the reasons I went into nursing. We had a shortage in the early 90s, and that's what brought me into the profession and got me interested. To begin with, the recruitment was heavy back then as well, so I know that this is not a new story. But certainly through COVID as well, we've recognized how much work our nurses have been doing. And I think it's a really great opportunity to hear some of their stories. So this is a study committee proposal. It addresses, in its effort is to address the staffing concerns and maybe come up with some new ideas, but more than anything to hear where the issues lie. I know that as you read through the legislation, it's typical study committee in the sense that it would be a 7-member committee, 3 members of the House of Representatives, President of the Georgia Nurses Association, President of the Georgia Chapter of the American Association of Critical Care Nurses, or a designee, and 2 members from the private sector appointed by the Speaker of the House. And then it goes into just the standards where folks would get the per diem for the study committee, and so that's sort of the nuts and bolts of the resolution. And if you don't mind, Mr. Chairman, I have Richard Lamphear is the president of the Georgia Nurses Association. I'd love to give him an opportunity to speak. And I can come up after and take questions as well. Is that okay? Shall we start that way?
Yes, ma'am. That is ideal. So that is Mr. Richard Lamphear
Yes, he's
is here with the Georgia Nurses Association. Okay, that would be just fine. Thank you, Representative Lott.
Thank you, Mr. Chairman and committee members. And I really think the conversation that I just heard can roll over into what we're seeing in nursing. Before the pandemic started, Georgia was ranked number 6 with the worst nursing shortage in this nation. Since the pandemic, we moved up the list, and we're now listed as the 4th state with the biggest need for nurses. And what we're looking at and what we'd like to see for this study committee is how can we identify how we can provide safe staffing to keep nurses at the bedside. I believe there's 4 nurses in this room today, and I think 2 of us are still taking care of patients at the bedside. And so we already see that nurses can gravitate to other professions. It's such, like we talked about with the CNAs, not only do nurses leave the bedside to advance their career, but also they're being picked from other industries to go work in industry, whether it's medical products, educational service, and things like that. So what I'd like to see the study committee do is to break that cycle of burnout, leaving the bedside, going to another profession, and how can we identify and provide safe staffing to recruit the nurses back to the bedside and really take care of the patients and the citizens of Georgia. Thank you.
Any questions from the committee members for Mr. Lamphear? Okay. Representative Lott, do you have anyone else that you want to speak before you?
No, I think we're good.
Okay.
If there's
all right.
any questions for me as well.
Any questions from the committee for Representative Lott about House Resolution 236? None on the line? Okay. All right. Thank you, Representative Lott. Anything else anything else you'd like to say about the measure?
No, thank you.
Okay, thank you, Representative Lott. Okay, so here's what I think we should do. I will tell you my thoughts. I will tell you that this is absolutely an important issue that we need to deal with. As was alluded to by Mr. Lamphear, you are correct, sir. The shortage of caregivers in this state, the shortage of nurses, the shortage of whether they're RNs, and we've got a good number of RNs on this committee, like Representative LaHood and Representative Robichaux and others. And so whether they're nurses or whether they're caregivers, there's such a shortage. But I'll tell you, I do believe it is difficult times to be doing a study committee. So I'm not going to accept a motion on this today. Here's what we're going to do. As a committee, there is no reason this has to be formal. We can have hearings anytime we want to, and we can do that remotely or otherwise. We have that right already. I think that is a better route to dealing with this issue, Representative. We can do that and have complete autonomy rather than to circumscribe ourselves to a formal study committee. And in times of a pandemic, even though things are looking much better, we don't know quite where they're headed. And with other likely special sessions coming up and so forth, I don't believe it is an appropriate time to do a formal study committee. And so I will not accept a motion on this measure today. But I do agree wholeheartedly.
Will you take a question now?
I agree wholeheartedly. Let me see. Hang on. I agree wholeheartedly that this is an issue we need to address, and I'd be glad for this committee to do it because I think we're very diligent here. Was there a question, Representative Bruce?
Yes, this is a question for you, if you don't mind.
Yes, sir.
The difference between doing it formally or informally, I think, is just making sure that people are properly compensated if they're traveling, to the meetings and all that kind of stuff. And to have a formal record of what's happening with regard to the legislation. I mean, so that I think that's the only difference between it. Is that correct?
Yes, sir. I understand that well, and that's a good point, Representative. Thank you, sir. Representative Lott, so anything you'd like to add?
So I appreciate that, and I know that you've done this sort of thing in the past, and this committee does a great job of reviewing things. I would just ask that if it's possible, if we would be engaged, I'm sure you would do that, but I would like to say it formally. If we could be engaged in the process and maybe help, we have folks that have a lot to say and we'd like to be a part of what you're doing, so.
I'd like that as well. So here's what I would say. I think we can have more engagement that way, frankly, because you can invite everybody and not be limited to the numbers of individuals here and those appointments. And so I think that we can absolutely accomplish everything you want to accomplish, and but in a way that might be more appropriate in the times of COVID.
I appreciate it.
Thank you, Representative. Thank you. All right, any other questions? Okay, all right. If not, this meeting is adjourned.